effective diagnosis is a prerequisite for successful therapy, considering the demand of quality diagnostics. FICCI Health Service Committee, along with healthcare providers, have stressed upon the need to bring improvement in the diagnostics healthcare in India.
I think in the diagnostics industry in India, it's very unfortunate that although we have 100,000 labs in this country, only 200 are accredited. So today we're functioning with a large network of laboratories and radiology centers, unfortunately, where the level of care is not as high, or the level of standards are not as high as they probably should be. And I think FICCI has had the really good vision of saying, you know what, diagnostic needs to be a more significant part of healthcare. Let's bring the diagnostic players into the FICCI committees, and I really credit Mr. Anjan Bose as well as Shivendra Singh for having that vision to say let's bring diagnostics as a more major part and see how we can bring the level of the industry a little bit higher.
In India, not only the practice of unnecessary diagnostics is very high, the mushrooming of diagnostic centers has also become a grave concern, all due to lack of regulation and standardization.
No, we are in healthcare is even if we call it an industry today, it is about life and life. I'm not saying life and death. It's about life of a human being. So we cannot play around with the lives of human beings. And if we are expecting good diagnosis, good treatment, then there has to be a protocol by which you have to be sure that the results are accurate. Because the entire treatment of doctors will be decided by the diagnosis that comes. So if there is a wrong diagnosis, the treatment itself will go in wrong direction. It could be fatal for a patient. It could be harmful for a patient. So I definitely think there has to be standard guidelines and regulations to control the quality of diagnosis.
It is imperative to regulate diagnostic industry, promote remote diagnosis tools like teleradiology, telemedicine and telepathology, and most importantly, encourage public-private partnerships in underserved areas to provide diagnostic services. CVB News, New Delhi.